Assalamu alaikum. My name is Dr. Mary Ibrahim, and I welcome you all to the third day of the Thought Leader series as part of DHCA's contribution to Arab Health 2021. Today, I have with me Dr. Ahmed Abu Tayoun, who is the director of the Genomics Center at Al Jalila Children's Hospital and an associate professor of genetics at Mohammed bin Rashid University of Medicine and Health Sciences. He completed his doctoral studies in genetics at Dartmouth College, followed by a fellowship in molecular diagnostics at Dartmouth Medical School. In 2013, he joined Harvard Medical School, where he completed his clinical molecular genetics fellowship, and in 2015, he became board certified by the American Board of Medical Genetics and Genomics. Dr. Abu Tayoun is a fellow of the American College of Medical Genetics and Genomics, and prior to joining Al Jalila Children's, he was a director in the Division of Genomic Diagnostics at the Children's Hospital of Philadelphia, and also an assistant professor of pathology and laboratory medicine at the University of Pennsylvania Perelman School of Medicine. Dr. Abu Tayoun's main research interests are centered around characterizing the genomic landscape of pediatric diseases in the Middle East and cataloging the normal genetic variation in this population. Dr. Ahmed.
Thank you so much for the introduction. It's a pleasure to be here.
Wonderful. It's a pleasure to read, honestly, and
Thank
to
you
be
so
with
much.
someone so knowledgeable and an expert in their field.
Thank you.
Let's start with an introduction on what genomic medicine is for people out there who
Right.
may not have a deep understanding of
Right.
what it is.
So, from the name, the genomic medicine is actually an emerging medical discipline where the genomic information or the genetic material of the patients or even healthy individuals is used in their healthcare. That information can be used depending on the setting for diagnostic purposes. So, for example, at Jalila Children's, we see sick babies. And we do genomic diagnostics, so we look at their DNA and try to understand if there are any changes that explain their
Yes.
sickness. But it can also give us information about how we can treat them or manage them.
Yes.
We will talk maybe more in a bit about the other applications, but that's in general the definition of genomic medicine. And the word genomic comes, of course, from genome.
Yes.
So it's a genes and the ohm. It's just a brief introduction about this. Genes is of course, the coding regions in our genome, and ohm refers to omics or a collection of data. So from the name, it means collecting large amount of data.
Yes, and now there's an emerging term that refers to the omics
Omics,
sciences
exactly.
that
And
all have to do.
right.
Yes.
And the reason for this is each cell in our body has 20,000 genes. Our genome is 3 billion letters. When you're doing genomic investigations, you're actually collecting a large amount of data.
Yes.
And that's why it's all referred to as a genomics medicine.
Wonderful. So do you think that genomic medicine is becoming more accessible these days?
Yes, for sure. I think it's a relatively new field, and the reason it got democratized and has been used so widely now is because of the technological advances and because of the completion of the Human Genome Project.
Yes.
The Human Genome Project was completed in 2001. It started in 1990, so it took us 11 years at a cost of $3 billion.
In the United States, if I'm not mistaken, yes.
With an international collaboration as well.
Yes.
So it took us 11 years to complete the first genome at a cost of $3 billion.
Wow.
But you could see, obviously, that you could not do this easily in a clinical or research setting. No one is going to pay $3 billion and wait 11 years to make a diagnosis.
Yes.
So what happened recently is the advances in technology where we are now able to do this much faster and more cost effectively. So to give you an example, at Al Jalila Children's, we are equipped to do 50 genomes in a week for a cost of a few $1,000s.
Oh,
So
wow.
this is how much
Huge difference.
technological advances,
Yes.
and that's why it's becoming accessible to research and diagnostic labs to
Yes.
use it on everyday basis.
And even maybe beyond diagnostics into treatment. So
Right.
what are some of the applications of genomics
Right.
for the population?
So the genomics, or the genome, is an instruction book. It's our own instruction book. We're born with it, and
Yes.
we're staying with it all the way.
Yes.
So it has a lot of information about us.
Yes.
And this information tells us how we look like, and it has healthcare information. So you could open that book at any stage in our life, right, and get some information that can be
I love that
helpful.
analogy. Yes.
Right. So the application is the applications that are currently used really at every stage. So Genomic diagnostics is being done postnatally on unfortunately sick children that have highly suspected genetic disorders. So this is where we look for changes that might explain their diseases and try to treat them or manage them based on that. There's also the application of on the fetus. So even before the child is born, there is something that's called NIPT. I'm pretty sure people know about this, non-invasive prenatal testing, where you take the fetal cells from circulating blood of pregnant women and test if there are certain extra chromosomal material like trisomy 21, 13, and 18. So this is even done to know if the fetus has any of those genetic abnormalities before they are born.
Yes.
You could also do screening, even taking this a step further before the pregnancy. You could do preconception or premarital screening, and this is being done now in certain populations to look for even healthy couples that are willing to build a family if they have any mutations that might increase the risk of having an affected child. So this is also, it's called carrier screening. Another application is cancer genomics.
Yes.
So, patients with cancer, we're now able to go look at the genetic changes in the cancer, and
for
based on that,
therapy.
exactly. And this is the whole idea of personalized or precision medicine.
Yes.
Rather than throwing chemotherapy on all patients the same way,
yes.
some of them have certain mutations where a small molecule will be more effective and avoid the side effects of chemotherapy, which can be very, very adverse. Pharmacogenomics is another application. So
another one of the omics.
I know.
Yes.
So it's some people respond differently to certain medications, and therefore knowing which mutations or changes in our DNA.
Yes.
This is a huge field that's now going
Yes, there is
up,
the misconception that one drug is one size fits all.
Exactly.
If someone has diabetes and they take diabetes medication, then it's guaranteed to work, which is not the case.
Right.
Yes.
So to sum this up, basically genomic medicine is helping us stratify patients, right? Not all cancer patients are the same, not all epilepsy patients are the same, not all hearing loss patients are the same, and knowing what mutations, which genes are affected will help us better manage them, treat them, and counsel the families about recurrence, because you don't want this to happen again in the family, and we share our genes with our loved ones, so we have to make sure they're aware of the chances that this might happen again. So going from diagnostics to prevention is always the barrier. That brings us
another slew of questions. Maybe we'll have another complete different interview about that and the ethics surrounding that. So yes, genomics is definitely gaining traction in the UAE. There are a lot of projects and policies and councils being formed. So, and one of the wonderful achievements at Al Jalila Children's Hospital is the establishment of the Genomics Center.
Yes.
Your baby. Can you tell us more about that, please?
So the center was officially inaugurated last year, so we're 1 year old by now. So I think it was officially launched in the presence of His Highness Sheikh Mohammed bin Rashid during Arab Health last year.
Yes.
So this is our first birthday, and I think we've done a lot of progress. We are the first CAP accredited with clinical genomic diagnostic facility in the UAE.
Wonderful.
CAP is the College of American Pathologists. So this is an attestation to the high quality testing that we do to diagnose patients. So far we have done complex genomic testing for over 400 kids that would have otherwise been traveling outside the country, or the samples would be sent out with
a relief to parents, of course.
Exactly, to get that care in a foreign country. And also, if you send the samples out, there's a lot of miscommunications, the turnaround time is long, and the cost is going to be prohibitive sometimes. So we're bridging that gap by having this genomic diagnostics center. Equally important, in addition to the testing, we have genetic counseling, right? Because at the end, we are dealing with patients, and the genomic investigations that we do can be complex. So having this vehicle to put this information in a simplified way for the doctor who's not genetics, make sense of it and what to do with it and how to manage the patients.
That is the vision, isn't it? To try to embed genomics in everyday clinical practice, so that even practitioners who are not experts in genomics are able to at least advise their patients on their options.
Exactly. That's exactly what we want it to be. We didn't want to have like genomics as a separate thing in vacuum.
Exactly, yes.
We wanted a genomic medicine program embedded in the hospital, like the infrastructure, because in the UAE we know the genetic disease burden is higher because of different social norms, the different genetic components. And so rather than having all patients be referred to a genetics clinic. You
Yes.
want to empower the non-genetics clinicians to be
That's the
literate.
perfect segue into my next question about the
Right.
challenges that we might face in trying to have genomics embedded,
Right.
about the challenges facing genomics as a specialty in general in the UAE
Yeah.
and in the region, if not the world. It's still
Yeah.
a relatively new science and
Right.
discipline, and we're still again in the earlier stages. So
Right.
what more, or what's coming next so that we can have a more effective genomics
Right.
plan here in the UAE?
Right. I mean, there are challenges which are, to me, are opportunities for doing good work to try to improve the
Exactly.
application
Yes.
of genomics. One of the challenges is the need of training the next generation at each level. Yeah, definitely, this is something that's a worldwide thing. For example, genetic counselors are like we have a huge deficit of genetic counselors worldwide.
Yes.
Let alone having genetic counselors that speak Arabic who are also well qualified to
Yes.
do this.
Yes.
Because we see the benefit, like you just mentioned. We wanted a genomic program that's embedded in the hospital, and having genetic counselor to work with the clinicians. We have joint clinics with non-genetics, neurology, genetic clinics,
Yes.
pulmonary genetics. So this is where genetic counselor supports the clinician and the families to understand what is it to do this genomic testing,
Yes.
what is the right test, and how to bring it back when the results are. So genetic counseling and education, number one would be genetic counseling in terms of training the next generation, but then there's I need to also train, molecular technologists, computational biologists,
Yes.
Bioinformatics,
Yes.
clinical. Once we do the sequencing
Because
of the,
data, of course, also plays
there's
a huge role.
there's a lot of
in-
data. We
Yes.
just started by saying omics and data, so you need people who are very comfortable with large sets of data and
Yes.
writing codes. But at the end, we're doing clinical stuff, so there should be also trained people qualified who understand what human genetics before reporting on a patient
Yeah.
report that this is the cause of your disease. It has implications. Like there are now gene therapies that are highly expensive. That has implications for the families. So
Yes.
also we need people trained in human clinical genetics to understand how to convey that information back.
Yeah.
That's on the educational and training level, but there are also challenges in terms of cataloging the normal variation, which I think something we'll talk about maybe more. Like, what is the reference?
Yes.
When you sequence a
So
patient
you're talking in the UAE context?
in the UAE, Middle East in general,
Okay.
is poorly represented in databases worldwide.
Yes.
So if you look at
one
some-
of your main
I
complaints
know.
about research.
I know.
Yes. Yes.
So less than 1% of genomic, the data sets available worldwide represents every other ancestry. The Middle East is less than 1%.
Yes.
It's gonna hurt this population more than it's good to get more representation to advance the human genetics field in general, but specifically this population.
Yes.
Because when we do the sequencing for a sick baby, we have to know what is the normal to compare,
And,
right?
and
to be
I
able
think
to
the UAE leadership is on that track,
Exactly.
and they have been talking
Right.
about launching the
Exactly.
Emirati Human Genome
Right.
Project for a while.
Right.
So hopefully good things on the horizon.
Right, and I
Yes.
think this brings me to that point that it's really great news because the leadership is really aware of the importance of
Yes,
this.
100%.
And the announcement that came up maybe a week or so ago about the
Yes.
Genomics Council to oversee the Emirates
Yes.
is really great news for all of us, because this means we can catalog the normal variation in the UAE, so we can better perform diagnostics and better treat patients when we find those changes. Like if you sequence my genome or your genome, we have millions of different variations.
Yes.
That's why I look how I look and you look different.
Yes.
Most of it is benign, and that's good. But there are things that are health related, and I would not know which ones are the health related
Yes.
ones or not if I don't have a normal catalog. So
Exactly.
it's like, oh, this is common.
To
it's my-
cross-reference, yes.
Exactly. So this is really important, and it's great news. It's one of the challenges, but it's an opportunity that I'm happy that it's happening.
Okay, so you wear many hats. You're at Al Jalila Children's
Yeah.
Hospital, you're at the Genomics Center, and you are assistant professor at MBRU.
Yes.
So in this role, how is Al Jalila Children's Hospital and MBRU addressing these challenges? How are there training programs?
Yes.
or-
So training is one thing, but I think you might have heard that we're launching the Center for Genomic Discovery
Yes.
with Muhammad
Very
Rashid
exciting,
University.
yes.
Yeah. So one challenge is the normal variation and the Emirati reference genome. But the second big challenge is what's called functional genomics.
Okay.
Right. So we have 20,000 genes in our genome. we know that 5 to 6,000 cause disease. There's
Okay.
15 to 12,000 genes that we don't know anything about them.
Wow.
And so therefore, there are definitely genes and mutations that are in our patients here that we don't know about them, because they haven't been studied elsewhere.
Yes.
Our population is unique to us, and if we researchers here have not studied them, it will be, it will be hard for those patients or those findings to be identified. So the Center for Genomic Discovery is building on the existing infrastructure between Mohammed bin Rashid University and Al Jalila Children's.
Okay.
And the idea is we will engage and recruit patients who have come to Al Jalila for genomic investigations, where they have done diagnostics, like for example, a test called whole exome sequencing, where all the genes are sequenced in one test. And then if they don't have a diagnosis, this becomes an opportunity to look for those unknown 10 to 12,000
Yes.
genes.
Yes.
But if we find something, we need to do some functional research and have a deeper look to really know if this is the cause and if this is a novel gene and a novel disease that is unique to this. So this is, I think, a perfect example where the children's hospital and the diagnostics the infrastructure is here. We have the equipment, we have the patient population, we're consenting them, we're analyzing the data, and the data exists.
Yes.
And then we have on the other side MBRU researchers who are very skilled and very talented people, and they have the equipment and nice facilities to do the research. So all we need is just to connect and focus on trying to navigate those
Sounds
genes.
like the perfect marriage.
Right. So and of
Wonderful.
course, as part of the DHCC ecosystem, we have Al Jalila Foundation, who's always there to support us with funds, right? So
And us regulation as well.
and the regulatory body is always like really very supportive, and all of this requires ethics approvals, right? So
Of course. Of course.
I'm sure I keep you busy with my questions. So
My pleasure,
it's your-
really. You're a pleasure to deal with, Dr. Ahmed. Okay, so since we brought up research, it's definitely expected to rise in popularity over the next 5 to 10 years. And a lot of researchers might want to get into this line of research and work. Do you have tips for them on how to do that?
Yeah, I think if I were to go back and do the training again, I would still do genomics, but I would learn more computer language.
Okay, very interesting.
Yeah, that's my one advice to whoever interested in biology discipline or healthcare or medicine, that they be acquainted with large data sets. It is the time where data acquisition is not the limiting step, it's making sense of the data. And Dubai and the UAE, from my impression so far, 3 years here, it's a smart city. It's all about, putting everything into, a data warehouse and easily navigating and connecting things together.
Yes.
I think it's a great like a system to be able to
that will probably come along with the Human Genome Project. Maybe there will be a
exactly.
Biobank where there's
Exactly.
storage of
And
yes.
Exactly. So I think a data bank even, right?
Yes.
Where all this data, because when you talk about the Emirati reference genome, you have the genomic information, but you have the health-related info, their well-being. How many visits do they go to the hospitals?
Yes.
What is their, are they have any diabetes? They have any
Yes.
comorbidities and stuff. So all this electronic medical record has to be, the phenotypes have to be connected to the genotypes.
There's also, I think, a project to connect all electronic medical records all over the UAE, which I think will also feed into that as well, which will be wonderful.
And the key there is to have it in a data warehouse that is easily talking to each other and easily queryable.
Yes,
and the
compatibility.
Biobank, you're saying a very good point here, which I didn't mention. The biobank is really important for functional genomics. You have to have biospecimens to be able to, right? So that's another important thing to keep in mind for these initiatives.
Wonderful. I think we have very positive and amazing things coming in the future. A lot of things to look forward to. And final question, where do you see the environment of research and innovation in the UAE over the next 2 decades, let's say?
I think there's going to be, given that this whole genomics initiatives, I think there's going to be a good chunk of genomic stuff, at least that's what I hope for, over the next at least 10 years or so.
Yes.
And like we just mentioned, because I think the emphasis on information technology infrastructure in Dubai, at least in the UAE, it just seems to be there's going to be a lot in that space. And in what I like more, at least from DHCC, also is having the university, the academic, institution, the healthcare system, and we also have a lot of interaction with Dubai Health Authority. So there is going to be a lot of translational work. You know, when you're doing the
Yes.
genomics, now we're doing diagnostics, but it really sits in between research
Yes.
and diagnostics.
Like you said, we want all these disciplines to be able to talk to each other in a way
Exactly,
that everybody
exactly. And because we
understands.
have the researchers and we're diagnostics and we're working with Dubai Health Authority and the whole DHCC, there will be a lot of opportunities to translate this to healthcare system
Yes.
and really, really move into something that we all talk about, like personalized medicine and genomic medicine. I hope we will be like some of the leading countries in doing this. I think we have a good opportunity.
Inshallah. Dr.
Yeah,
Ahmed,
yeah.
thank you. It's been a
Thank you.
pleasure as always. Thank
Yeah,
you all
yeah,
for
yeah.
joining us today. Please come join us again for 3 more interviews for the rest of the day. Bye-bye.